Okay, so I'm just going to get started even though no one has logged on yet, just so I can click through the slides. If anyone comes to review the recording later, they can see all of the slides. Okay, I'm now going to upload the next part of the Level 3 Success Series, which is taking the information that was in that PowerPoint and applying it to some practice questions. Okay. How this works is I'll first show you a question like this. A 38-year-old female is admitted for an elective surgical procedure. Which information obtained by the nurse during the preoperative assessment is most important to report to the anesthesiologist before surgery? So take some time here and try to pick out those keywords that were on the previous PowerPoint. What things are you going to hone in on that are important for this question in determining the correct answer? Okay, so the key things you want to focus in on for this question is going to be that she's a 38-year-old, she is a female, this is an elective surgery, we're looking for the most important thing to report to the anesthesiologist. So we're keying in on the fact of her age, that she is female. This surgery is elective, it's not emergent, it's not urgent, there's time to go over and look at everything from every perspective. We're looking for the most important thing to report to the anesthesiologist. So think of the role of the anesthesiologist. What is he doing? He's doing the pain medications, the sedation, a lot of different very potent medications that he is in charge of. So there's a lot of different factors he's going to need to know. So from here, we then look at our options. So A, the patient's lack of knowledge about post-op pain control measures. B, the patient's statement that her menstrual period was 8 weeks previously. C, the patient's history of post-op infection following a prior cholecystectomy. Or D, the patient's concern that she will be unable to care for her children post-operatively. So now taking a look at these answers, first try to rule out things, bearing in mind that we are talking to an anesthesiologist. So I think one of the things that we can rule out immediately would be D, the patient's concern that she will be unable to care for her child post-operatively. Anesthesiologist isn't going to be involved in the going home and safety at home part of this patient's hospital stay or surgical procedure. So from there, there's really no reason to tell this to the anesthesiologist. You can eliminate that one right away. From there, we have 3 answers now. So lack of knowledge about post-op pain control measures, patient statement that her last menstrual period was 8 weeks previously, and the patient's history of post-op infection following a prior cholecystectomy. Working through that, again, looking for the most important thing to report to the anesthesiologist. If those were 3 things to report to an anesthesiologist, which one would be the most important? Or if you're struggling between 2, eliminate one that would be the least important of the 3. So the least important of the 3 might be the lack of knowledge about postoperative pain control measures. So it is important that the client learns what pain control measures she's going to need postoperatively. A bigger priority between the 2 would be the risk for infection and that her last menstrual period was 8 weeks previously. Now we've eliminated it down to 2 options. So going back to the other aspects of this question, keying in that this is an elective surgical procedure, so it's not immediate, it could be postponed. And then also looking at the fact that this is a 38-year-old female, being 38 years old, she is still in her prime years of conception. The priority for the anesthesiologist would be to then know about her last menstrual period being 8 weeks previously. The patient may be pregnant, and pregnancy test is going to be needed before administration of anesthetic agents. This holds priority over all other issues that can be addressed by the surgeon, the MD, or a caseworker later. So moving on to question 2, which assessment finding in a patient admitted with acute decompensated heart failure, or ADHS, requires the most immediate action by the nurse? Take some time to figure out what the key points are in this question. Okay, so in this question, you want to cue in on the fact that the patient was admitted with ADHS. So this is the patient's background. We're just admitted with ADHS, and we're looking for the most immediate action by the nurse. This is going to be the first thing, the priority thing that you're going to be doing as a nurse. So we have oxygen saturation of 88%, a weight gain of 2.2 pounds, a heart rate of 106 beats a minute, and a urine output of 50 mLs over 2 hours. So start thinking in terms of priority. Which one of these things can you eliminate? Of the 3 that you have left, which one is the least important? And of the 2 remaining, which one do you feel requires the most immediate action? The answer is A, oxygen saturation of 88%. So an O2 under 92% in a patient who does not have COPD requires immediate action. Airway takes priority. 88% O2 is not an expected finding. The other 3 symptoms are expected findings in worsening heart failure. So remember, this patient has heart failure. It's worsening, they're decompensating. We're going to expect to see weight gain. We're going to expect to see an elevated heart rate. We're going to start to expect to see the kidneys not functioning as well, and that's where we're seeing a dip in the amount of urinary output. But oxygen saturation is not going to be affected by ADHS, or shouldn't be. It's not expected. And because airway takes priority, and this patient isn't listed as having a history of COPD, A is the correct answer. Next question. A 56-year-old patient who has no previous history of hypertension or other health problems suddenly develops a blood pressure of 198 over 110. After reconfirming the blood pressure, it is appropriate for the nurse to tell the patient that, so take some time to figure out your key points now. The key points we want to focus in on is that the patient is 56 years old, has no previous history of hypertension, the blood pressure being 198 over 110, and you're looking for what it's going to be appropriate for the nurse to tell the patient. So bearing those in mind, we'll look at the options. So A, a blood pressure recheck should be scheduled in a few weeks. B, dietary sodium and fat content should be decreased. C, there is an immediate danger of a stroke and hospitalization will be required. Or D, diagnosis of possible cause, treatment, and ongoing monitoring will be needed. So, which one of these things can you eliminate first? Okay, now that you're at 3 options, which one of these things does it seem like a nurse is not allowed to tell a patient? And now, with your 2 answers left, determine what is the most appropriate thing to say to the patient in this situation. The answer is going to be D. Diagnosis of a possible cause, treatment, and ongoing monitoring will be needed. Blood pressure this high cannot wait a few weeks to be reassessed. Dietary changes are orders from a doctor. No evidence of stroke, and it's not in the scope of practice to release information if it was. So that would leave us with just D. You can let the patient know that they are going to need to be monitoring and figuring out what's causing this and possible treatment to bring the blood pressure down. You cannot say that there's an immediate danger of a stroke, and you cannot say whether or not hospitalization will be required. Those are determined by the doctor, as well as the diet that's most appropriate for the patient. And again, blood pressure this high needs to be immediately addressed, not scheduled in a few weeks to be reassessed. Question 4, a patient who has a small cell carcinoma of the lung develops syndrome of inappropriate antidiuretic hormone, or SIADH. The nurse should notify the healthcare provider about which assessment finding. Take some time to hone in on the key points in this question. So the biggest things here are the development of SIADH, as well as we're notifying a healthcare provider about which assessment finding. So we're going to look for an assessment finding that's noteworthy enough to tell the healthcare provider, and we're remembering that this is a new development of SIADH. Bearing those things in mind, these are the options: reported weight gain, serum hematocrit of 42%, serum sodium level of 120, or total urinary output of 280 mL during the past 8 hours. Take a moment to eliminate one of these options. Now that you're down to 3 things, which one of those 3 would be the least important to tell the doctor? And now, given the 2 that you have left, which one takes priority in reporting to the healthcare provider? Your priority is going to be C, serum sodium level of 120. A new onset of SIADH is what is critical here. With SIADH, patients will have water retention. Water retention leads to hyponatremia, which can cause neurological issues and needs to be corrected. Weight gain is expected. 30 mLs an hour is a normal urinary output, and the hematocrit is also at a normal level. Question 5. The nurse in the emergency department receives arterial blood gas results for 4 recently admitted patients with obstructive pulmonary disease. Which patient would require the most rapid action by the nurse? So take a moment to hone in on the key parts of this question. You want to clue into the part where you're going to be reading arterial blood gas or ABG results, that all of these 4 patients are admitted with obstructive pulmonary disease, and that we're looking for the priority, the most rapid action by the nurse. Bearing those things in mind, these are our options. A 22-year-old with ABG results of a pH of 7.3, CO2 of 55, and O2 of 84. B, a 34-year-old with ABG results of a pH of 7.5, CO2 and O2 of 88. C, an 85-year-old with ABG results of 7.36, CO2 of 37, and O2 of 92. And finally, D, a 65-year-old with ABG results of 7.32, CO2 of 50, and O2 of 84. Take a moment to eliminate one of these results. Now that you've eliminated one, take a look at the 3 you have left. Which one has the least priority for the nurse? Now, of the 2 that you have left, who is the bigger priority? Who requires the most rapid action by the nurse? The answer is A, the 22-year-old with a result of a pH of 7.3, a CO2 of 55, and an O2 of 84. So we're going to look at that O2 level first. Whoever is saturating lowest is the priority. So that leaves us with A and D. 92 is normal, 88 is low, but it's okay in comparison to an 84. From there, we're going to look at the pH. The 65-year-old is still a bit closer to normal than the 22-year-old. So our priority would go to the 22-year-old, then the 65-year-old, then the 34-year-old, and then the 85-year-old. Last question. The intensive care nurse is caring for the client who has had intracranial surgery. Which interventions should the nurse implement? Select all that apply. Take some time to key in on the key points of this question. The key points are that this is a client who has had intracranial surgery, and we're looking for interventions the nurse should implement. It is also important to clue in that this is a select all that apply question. So that means that there's going to be multiple correct answers. So look for multiple correct answers, not just one. Bearing those things in mind, these are the options. 1, assess for deep vein thrombosis. 2, administer IV anticoagulant. 3, monitor intake and output strictly. 4, apply warm compresses to the eyes. Or 5, perform passive range of motion exercises. The key to doing select all that apply questions is not treating it like it's one giant multiple choice question, but instead more like 5 yes or no's or true false questions. So, bearing in mind the question, we'll go through each answer. The intensive care nurse is caring for a client who has had intracranial surgery. Which interventions should the nurse implement? 1, assess for deep vein thrombosis, yes or no? 2, administer IV anticoagulants? Yes or no? Three, monitor intake and output strictly. Yes or no? Four, apply warm compresses to the eyes. Yes or no? Five, perform passive range of motion exercises. Yes or no? The answers are one, assess for deep vein thrombosis, three, monitor intake and output strictly, and five, perform passive range of motion exercises. For one, deep vein thrombosis, which is a complication of immobility. The post-op client is immobile, so you would want to ensure that you're going to assess for this occurring. Two, anticoagulants may cause bleeding. Therefore, the client who has had surgery should not be prescribed this medication. Three, monitoring of intake and output helps to detect possible complications of the pituitary gland, which include diabetes insipidus and syndrome of inappropriate antidiuretic hormone, SIADH. Given the procedure they have, this is appropriate to assess for this patient. Four, the nurse should apply cool compresses to alleviate periocular edema. Heat would increase blood flow and potentially cause swelling in the area. Five, the nurse does not want the client to be active and possibly increase intracranial pressure. Therefore, the nurse should perform passive range of motion for the client. This also helps prevent TVT in the postoperative immobile patient. Okay, everyone, that concludes the last of the Level 3 Success Series. Moving forward, I will be doing pediatric reviews for the rest of the semester every week. So keep your eye out for the dates that I will be holding weekly pediatric review sessions.